So, hello and welcome, dear Dental TV subscribers, LinkedIn users, Instagram users, wherever you're watching or listening us. It's a great pleasure to have Ramin Tabib. So, basically, we
Ramin
did
Tabib.
have that. Ramin is your first name, and Tabib
Yes,
is your family name. That's
that's
cool.
correct.
That's a very interesting dentist from New York City. By the way, our younger son is in New York.
Oh,
But maybe today he's not in New York. He's in Washington or Miami because he's a private chef. And this week he's
yeah, you
working
were
for
mentioning.
a client, and they are traveling around. But basically, he flew into New York and will fly back home this Sunday. But for sure, we'll get back maybe next. But his schedule is always filled up. So basically, it's my pleasure to have you here over the pond, so
Yeah,
from Europe to the US.
thank
Maybe
you for having me.
you introduce shortly yourself, and then we dive into some interesting stuff that we need to share with our audience.
Sure. So I am Ramin Tabib, dentist in New York City, practice with my wife. We're both dentists, been practicing for, I'd say, over 30 years in the same practice. It's I would say, a unique practice because it's pretty small in size. It's 700 square feet. So I don't know what that's in meters, but it's pretty small. So we have 3 operatories. Both of us share the same office and same time. What's unique about us is that also because of our size of our office, we were forced to practice in a certain way. And not so much forced to, we wanted to, because we really couldn't be like a family dental practice. It's not designed spatially. We can't even accommodate that kind of practice. So we always wanted to do dentistry the right way. And, sometimes you get into bad habits when you start to practice. And, like I'll take insurance, I'll do this, I'll do that. And then you start to develop bad habits and you can't get out of it. Because of the size of our practice, we couldn't really develop bad habits. We could only see 1 or 2 patients at a time, so we were always forced to be very, very specific in how we treat patients and always on time and always, see patients uh, for specific needs. Not, like it became what you would call a cosmetic practice and developed into a comprehensive treatment planning. She has special skills that I don't. So we both sort of quasi specialists, I would say, in our practice. Patients are shared between us a lot, so she sees
So
part.
basically, you're focused on cosmetic or aesthetic dentistry. That's right.
Correct.
Yeah. So
That
because I know from the difference in the US or European system, in Europe we have the majority. It's switching a little bit, but the majority of dental offices in Europe are private practitioners who are doing basically almost everything. So a little bit of aesthetics, a little bit
sure.
of endo, a little bit of that, a little bit of this. So in the US we have more specialists. That's correct.
That's that's correct. I would say I wouldn't say dentists tend to focus more on one specific area, I think. And a lot in recently has happened where everybody wants to do cosmetic dentistry. Unfortunately, I feel like most people who do tend to go in that direction don't get the specific training they should and do the work that needs 10,000 hours that's required to call yourself that. You can't take a weekend course and think you can, treat difficult cases. And so, yeah, I mean, I think everyone wants to be very, very specific, but it's very hard, I would say, initially when you're doing that because you have to feed yourself, you have to feed a family. So you end up seeing everything. We were lucky because we're dual income, so we could, our suffering wasn't as challenging as maybe others would be if you're a solo practitioner. And we never bought a practice, for instance. We started from zero, like no patients whatsoever. Our first patients were my family members, which
Oh, that's cool. Because that's maybe another question.
sure,
When you started, I think, or I guess, already at your time when you were a student, you had to pay for your education yourself. So the American system was the same already some years ago, or did it change? That when I was last year in New York, seeing that a dental student has to pay 120,000 per year to learn
yes,
dentistry. And so if you make the calculation, the education, the cost of living, so you end up with 1 million, with investing 1 million before you become a dentist. So what was
right.
it, the same in your at your time, or was it different?
It was always the same, and I just think I feel that the cost of education has dramatically increased based on cost of living, and it's I remember when I went to Columbia Dental School, it was somewhere around 20,000 and change. Even that was with room, and so I guess that dates me quite a bit. But now it's like 120,000 just to get the education per year. You come out with a huge debt, and now you want to start a practice, and it's not only you have to pay back the education that you spent, loans that you accrued through that time. Now you have to figure out how you're going to feed yourself, how you're going to develop business. So it becomes a challenging situation, and I would think nowadays it's much more difficult to set up a practice than when we did.
Do you feel that let's say, a young dentist is forced to do? I want to be a little bit provocative. Do you
Yeah.
think dentists are forced, because of this economical situation, to be a little bit unethical? So basically, do over treatment because they know I need to make money.
Yeah,
That's a,
I mean, it's
you know.
very difficult to answer that, but I could say just by cases that I'm seeing, overtreatment is more apparent now than it was when I initially started out. I see a lot of cases with reconstructions that need to be reconstructed. So, and this is not a matter of 20 years. I'm talking about matter of 5, 6 years. They need to be redone, and cases that are, I would say, going in the wrong direction, starting out in the wrong direction from the get go. It's almost like, to me, if you look at a house, right? The last thing you want to build is the outside look and paint and all that stuff, and but it seems like it's starting from outside look in, like, make it pretty, and then worry about let somebody else worry about the foundation,
Yeah.
make the patient happy with the beautiful cosmetics, and hopefully it'll last. That's
Or
I
you or
would
you
say,
can or you can move your practice every 5 years,
every 5 years
change
somewhere else.
change the town, so your patient do not follow you or don't know where you are. No, but
Yeah,
no, what my point is, you are forced to do treatment that you might not be ready doing it. You know what I mean? So after
totally.
graduation, or the first 5 years after graduation, I think you still have a lot to learn. And
Right,
then you are in the situation, I know that I need to perfect my skills to become a
right.
good dentist. And on the other hand, I'm forced to make some money, because otherwise the bank says, hey, come on, Ramim,
Yeah.
hey, go a little bit faster.
Ethically, you could do a simple filling, or you could convince a patient that it's better lasting if we put a full coverage on it in the future. So you can easily sway a patient's thinking in your direction if you are forced economically to make decisions in a certain way. That's why it's a very, very tricky thing when you're coming out of school with so much debt and forced to do things that are that are unethical, um, it sets you up for a lot of problems in the future. And I don't think you're set up to be a happy person. I feel like, in the long run, because it'll catch up. That type of dentistry, unless you're not aware of you doing it, then you don't know. What you don't know, you don't know. But if you are aware of it and you're doing it, it's going to catch up with you at some point, and you're not going to be a happy person.
Yeah, because a lot of our colleagues around the globe are happy with being unhappy. Let's say they are they're as I describe it, in their hamster wheel. They're doing their job. Maybe they even realize that they could improve, that they
Right.
could do better. But well, patients are not complaining. Why should I change something? And that leads me to an interesting
Mhm.
point that we discussed last time, that you're not 25 years old.
No.
Yes, me neither. And I found it very interesting that you have plans to educate yourself, to promote yourself, to become a better dentist, even at an age where a lot of our generation, maybe even before that, are
Sure.
already going slower, in the sense of, well, I don't need that education. I know I don't need a new equipment. I don't need this because, yeah, in 10 years, in 5 years, I will
Sure.
retire. Making the last 10 or 5 years, it's still 5 or 10 years of your career, extremely boring. And I think you are one of the person that says, no, I'm still hungry.
Yeah.
This was something I had in the last interview I did with a young dentist from Lithuania, asking her, why are a lot of these young generation dentists that are pushing, doing education, being very active also on social media, from Eastern Europe? And then she was telling me, because we are hungry. And
Yeah.
this is a good point. They are hungry. They want to reach something, and in Europe, or maybe also the US, it's a little bit, let's say, saturated. We
Yeah.
have everything. Why should we move? Why should we explore new ideas? And tell me, what was your motivation to decide
Yeah.
to say, okay, I want to change something. I want to find new inspiration, or what was the
Yeah. I think
intention?
it's yeah. I think it's all based on a level of curiosity that you're born with. If you're a curious person, you never feel satisfied with your level of knowledge. You're always searching for more. You want to do better. It's a striving for excellence that should drive you, not striving for perfection. Obviously, it's an elusive thing, but striving for excellence. If you're really curious mind, 2 weeks I'll be 60 years old. You wouldn't think that I would be taking courses with Pascal Magne, for instance, and I'm there taking courses there. I'm probably one of the oldest ones there. There's a lot of young kids, which I'm very happy to see that they want to learn from a master. But I never feel like I know everything. I never ever felt, I always felt like I need to learn more. And I'm curious about new things coming up. I'm curious about the science and curious about all of it. So it forces me to, actively pursue knowledge and ethically apply it to my practice. So I think that is, if I could instill that in any young dentist coming out, I would say to them, be curious, always be humble, um, be ready to take in information, and don't ever feel like you know something. As soon as you feel like you know something, that's when um, you're setting yourself up for a career downwards. Because if you know everything, there's really nothing else to do.
Yeah, there's nobody knows everything. Not even AI tools know everything. So
Absolutely.
no, no. But do you communicate the fact that you are going to learn new things or improve your skills? Do you share this information with your patients?
Good question. Probably not as much as I should, and some of it is like, you know, I do put it on social media that I am taking courses, not as often as I should. Some of it is maybe, you reach an age you think like, if patients think, in subconsciously it's like, oh, if you tell them that you're taking courses, maybe you don't know something.
No, but
So
it's the way that how to communicate.
how do you, yeah,
Basically, I would say I have like a joke that I'm doing very often with my patients. I do a CEREC restoration, and then it was maybe, yeah, a challenge to really do it the right way. It's always a challenge. And then at the end, I tell the patient, wow, the older I get, the better I get. And then I start laughing. You know what I mean? And
sure, of
they
course,
laugh as well. But this sentence is not about saying, "Wow, I'm a cool guy."
right,
It's about saying that I'm still striving for the best. I
yeah,
want the best for my patients. So this is I think a message that you should shout out. You should
sure,
communicate with your patients, telling them that you are taking care of them and
of
that
course,
you
yeah,
want to become better over time and not say, well, when I finished dental school, I had my
yeah,
top level, and for since then,
right,
I lowered my handicap in golf, but I didn't lower my
yeah.
or I didn't raise the bar in my dental education.
Absolutely. And I think I would also add another aspect that's important for dentists to be aware of is to have fun. You know, dentistry, as you know, is a very stressful career. And if you're not enjoying it, it's going to build up and you're going to resent your career and resent your life at some point. I think you need to ground yourself and realize what is it that about dentistry that you like? How can you make it fun? What is fun to me? For me, like for instance, in my practice, I'm a big I joke around with all my patients. I really do, and um, certain ones you got to be careful, but uh, but I like to be myself and have fun. So we do a lot of silly things in the office. I do like Friday dance and put that up on social media. So it's the more you try to lower the bar of stress in the practice by just, getting up and dance by yourself for a few minutes and then go see a patient or just uh, laugh a little bit and then go see a patient and just it's a stressful career, so don't try to make it more stressful, adding to it with being resentful of something or angry. Just enjoy it. Just try to be as much as fun as you can be. And believe me, it'll pay back in dividends. Patients love to see that you don't take yourself seriously and it lowers their tension level because when you're tense and you're coming in with a little bit of a level of stress into the to see a patient, they're going to feel it. It's not you don't have to say a word. It's an aura that you'll put up and a patient will feel it and they'll feel stressed. Anesthesia won't work and then you blame the patient, then you get angry, she gets angry. It just can cascade. But if you start off with a level of happiness and fake it. Even if you're not, just fake it. Just jump up and down a little bit and then go see a patient. It really does help because you can change your physicality to affect how you perform. If if you go in like this and like, oh my God, I have to see this patient again, that's going to affect everything. But if you jump around and say, you know what, I'm going to make it. This is going to be fun. Who cares? Let's just do this, baby. Whatever it is that'll get you up, and just go in, and you'll see the energy level when it transforms and happier. Patient will act differently. You'll act differently. Everyone's happier that way.
Absolutely. I love watching your videos, your dancing videos, and I always put my dancing comments below.
I see that. Yes.
No, because I think it's exactly what you're highlighting, that too many people are taking too many things too serious. But if we are working, then we should focus on what we are doing. So basically, if I start drilling or any
Yeah.
doing anything in the mouth, I think then the fun is over. But then also the patient knows, okay, now I have to open the mouth, and now something happens in my mouth. But also during the treatments, there's always time to relax yourself,
Absolutely.
relax the patient. I totally agree. And that's why I'm a little bit afraid of social media taking over with too much negative energy.
Mhm.
There, from my point of view, too many people out there trying to convince us that we have mental health problems, that we are too much stressed,
Yes.
and then selling courses. I'm not I'm not just, you know
Sure.
what I mean.
No, I know
It,
what you're talking
it's
about.
a it's a phenomenon that it's not only related to dentistry. You see that all over the place, and there's a huge discussion now that, especially if people that you never would think of that they ever had a mental health issue are now becoming coaches and talking about,
Sure.
oh,
Yeah.
life is so stressful. It's so, but you know what? I can help you, and
Yeah.
that's why I love talking to people like you who say, well, we have a profession that is not easy peasy. My brother is doing software, so he can work from wherever he is. We have to go to our office and work there because we have to see our patients, we have to do
Right.
this. But we made the decision to do that. I love my profession, I love what I'm doing. And you are right, mixing it a little bit with being relaxed,
Yeah.
laughing also about yourself, and reducing the stress level. I think meditation, there's so many ways that you can do inside your office or around the
Right.
office,
I think
reducing,
also
reducing all
what I
this.
would say to that is, don't take yourself seriously. Take your career seriously. Take your what you're doing in dentistry seriously. You know, don't let ideas of mental illness that's been going around affect how you think about your career, because I think you can be manipulated into thinking there is something wrong with you and your career is causing problems. And I just think a lot of this is, like you said, sometimes fabricated to monopolize on a situation and monetize on it. But we do need better support groups. We do need to get around each other as dentists and really support each other as much as possible we can. And I know it's tough for some people, and that has to be respected. You know, just I hope my hope is that if there are courses that are coming out for that type, or help that's coming
Yeah,
out,
but
coming
that's
from a good heart, not coming from a way of, let me see how I can monetize this, because I know there is
but I
something
would
I
I would I would say, there's you made a perfect statement. What we need is more people talking to each other.
Yep.
And it's not a gathering in a conference, because there is too much blah blah. And I think the really personal connections do not really happen, because you enter the room, hundreds of people there. Oh, Ramin, bam bam, you're a nice guy. Hey,
Yeah, yeah.
Alessandro, you're a nice guy. It's very superficial.
Right.
But and you would never in this surrounding, you would never say, hey, Alessandro, can I talk to you for a minute, because last week I felt a little bit depressed, or I had
Yeah.
some issues with some patients. What would you do in this situation? I have this patient who's really stressful and calling me even at night and blah blah. So look for some professional help with each other. And what I see is that this is something lacking, and maybe not only the dental community, that we are like egos, not egos in the sense of ego
Mhm.
of divas, but egos in the sense of you don't look left or right, and you should communicate more with each other
Right.
to really solve issues
Yeah, I
and
don't
not
think it's
and,
an issue
huh?
that's only relevant to dentists. I'm sure there's a lot of careers that are probably go through the same concerns that we're talking about. And if there was a forum where dentists would feel comfortable talking to each other, or when you see each other in a meeting, move away from the surface. Oh, yeah, my practice, this and that, like, how you doing? Are you holding up? Do you have any issues in your practice? Because I know I'm having some problems here and there. Sometimes talking about it with each other, just getting it off your shoulder. It helps having someone to listen to you. I have my wife. We talk to each other all the time. So sometimes in a solo practice, it may be challenging because you feel like you're alone. You don't have anyone else to talk to. You can't go home and um, you know tell your husband or wife that, "Oh, I had a tough day," and like, "Oh, well, you had a tough day. Let me tell you about my tough day." It then becomes a battle of wills and not helping each other. And I think maybe that's where the disconnect is happening, where there is no camaraderie, there is no deep connections with dentists, colleagues to really just talk to each other. And I think if
it could we,
something like that is developed, would be great.
it could be like the anonymous alcoholic
Yeah,
meeting each other.
totally.
You know what I mean?
Yeah,
So I think this would be the concept of meeting each other, and this could be also done online. That
totally.
you
Yeah,
say a group of 10 people, not too many. So, and like in these groups, you have 10, maximum 15 people sitting in a circle and then talking to each other, or somebody starts talking about what happened last week, and then you have like an interactive discussion. People are listening and
right.
interacting. I think this would be a cool thing to set up
Yeah, I
and
think so.
meet and talk to each other about anything, you know?
In a non-judgmental surrounding, people
Yes.
just listening and paying
Yeah.
attention, just
Yeah.
listening, not offering advice. Let me
Yeah.
listen to what you
Yeah.
have to say.
Yeah.
I think a lot of times what we want to do is not listen, but correct, or make an assessment and judgment about a situation that they're talking about. And I think most people fall into that category of not listening properly. Listening means not opening your mouth. Just, you have 2 ears and one mouth for a reason. So you just listen to people and let them talk about it, and then say, how can I be a support to you? How can I help you in this? Is there anything I that is goes a long way. That's like, well, you should be doing this. Maybe if you do, nobody wants advice that's not relevant to them, and especially when people never asked for advice. I think most people need to be listened to, not given advice, unless you need the advice and you would say, could you give me advice? But if there is a forum where people listen to each other really well, and someone could moderate it to make sure that everyone's listening and not really judging or causing or giving advice for no reason when it's not asked for,
So we
then
can
you have
start
a
we can
very
start
healthy
something like this.
forum of discussion. What's that?
We can start something like this.
I think that would be great.
Yeah, let's, because this came to my mind talking to you, that this would be a great concept to
It
create like
sure,
a regular club where we just meet and talk to each other. Just could be also international group. But let's brainstorm and
yeah,
think
I think
about
so.
that.
We could do that. We could come up with some ideas.
So before we close this interview, I have to
Sure.
ask you a personal question. Why
Okay.
are you wearing these glasses?
So I've been wearing these for, I would say, almost 12 years, I went shopping downtown and I saw these glasses and I'm like, okay, I'm going to buy them, but I don't know if I can wear these. And then everyone's like, oh, they look pretty cool. There was originally just sunglasses. So I'm like, okay, people like it. Let me make it into a reading glasses and use for every day and be able to. So it became my signature look because everyone started to like look at me in this, find me by these glasses. And it's interestingly enough, because I have a little bit of a presence in social media, sometimes when I travel, I see other dentists like, oh, I've seen you. I remember you by your glasses. So it sort of became a thing. And
Yeah, because I'm starting a new project with the owner of three shops. He sells glasses in Zurich. So, but
okay.
basically at the very high level. So one of his shops is has a tradition. I think it's 150 years old already. And I told him, look, we need to create a series of videos where we talk about the impact of glasses or the importance of wearing. So basically, I have my working glasses are different, so the face looks different. That's why I decided to take a little bit a glass that is a little bit softer. You can switch. So basically, these are the Ray-Ban Meta.
Oh,
So they are
that you can film with.
film and take pictures with. I have several glasses that I use,
Right.
and now we are starting a new project, or basically I'm starting also a video coaching school with many other things.
Now
So
you're
basically,
doing some amazing things in the industry with photography and social media, how to, I think you made an impact in how I see things and how I like to present myself in social media. You've definitely learned a lot from you. And I was, I still have your book that I purchased beginning of my career. I still have that. What is
cool.
the fundamentals of photography?
Fundamentals of color.
Of
Yeah.
color. Yes, that's right. Yes, I still cherish that book. Yeah, and I think for the glasses, I need to scan these because they don't make it anymore. Because if I lose this,
Yeah,
I
you
don't
need
know how.
to. Yeah, but today that's easy to scan them and make a copy,
Yeah,
3D
I think that's
printing
what
or
I'll have to
whatever.
do.
Cool. Cool. So I have to go and get our pug,
Oh,
CC.
okay, getting groomed.
So, yeah, yeah. And because during the week she's with other dogs, and she
Yeah, we have
enjoys
a dog too. We put him in a
she
daycare during the
yeah,
day.
that's a dog daycare. It's like
Yeah.
but for her, it's really cool to meet all these other dogs jumping around.
Oh, of course.
She's the smallest of all, but the small dogs are sometimes the
The
craziest one.
most
Yeah, and
bigger
pugs,
dogs are scared of.
yeah, and pugs are special. Pugs are not dogs. Pugs are
Yeah.
something different. Okay, so Ramim, thank you very much for
Thank you,
taking your
Alessandro.
time, and we will think about the anonymous dentist.
We'll come up with a plan
So an idea to
and a
meet
good
each
name for it.
other, and I'm sure that this will not be the last interview we are doing. I'm continuing to talk to as many people as possible to share ideas, to share inputs. I think this is important in our stressful life. But
Yes.
thanks again for
Thank you so
reducing
much.
our stress.
This was very, very fun. I enjoyed it.
Thank you.
All right,
Okay.
Alessandro, you have a great day.
Thank you. You too.
Bye bye now.